Welcome. This is Tulare Community Health Clinic. We are at Woodville, and I'm going to be talking a little bit about how we started, how we got here to Woodville. Tulare Community Health Clinic is a federally qualified health center. I am of a migrant background. I was a migrant student in my childhood, and Woodville is a community has a migrant camp, a lot of farm workers and dairy workers in the town of Woodville. So what federal had new access point grants, which we called NGAs, and the clinic decided, when we were looking and did a study in the community, we did a community survey, and we saw the need to open a location in Woodville. So I took it to the board to apply for this new access point grant through the federal government. And we applied and we were granted. Meanwhile, while we were doing the community survey, we outreached to the Woodville school, and we spoke with the superintendent, Dr. Dagoberto Garcia. So Dr. Garcia says, we have a building. It's a utility building, and we aren't using it right now. You're welcome to use it. He invited me to his school board meeting so we could have an approval of the school board to be able to rent this building. So the board granted us the privilege to use the building and remodel it. As we went further through the study, we waited and we were not awarded the award for Woodville. Then months later, around October, November, the Fed said, guess what? You got it. So we got the award. And so we went full speed. And then when we decided, we went back to the drawing board and we said, no, we need more. We need a bigger building. So that's when we decided to look for land. And so we saw this acreage that we are located in today that was empty, raw land, plain dirt. And it was on the same street as the school, and we wanted to be near the school, and now we are across the street from the school. We want to be able to help the community. So we went ahead and worked with the county, because we discovered that the land was considered agriculture and residential. So we bought 2 lots from the Tully Dryer, who was a former owner of this land. We went to the county, and Mr. Eric Coyne, the planning commission, and everybody in the county who was helping Mike Wallish, different names. Also, our county supervisor, Ishida Outreach, called us and said, we support you, move forward. And also our Tulare County Supervisor, Pete Vanderpool. And here today we have Mr. Phil Cox, Mr. Innes, Mike Innes. The county supervisors have been very supportive. Everybody in the county, they made everything go very quickly.
I think we set another record here. 53 days from the time we started doing the permits and the rezoning until they were in construction. Started in December, they started construction in February, and here we are today, an open clinic. So it's going to create about 16 jobs, new jobs for Woodville area. And we just, if you look at the family health care we opened in Terabella and this clinic, that's 2 we've opened in the last year. And then we got a major reconstruction going on one of the larger family health care clinics in Porterville. So much needed for this community and all of our small communities.
So as we were going through the plans, we have 6 medical exam rooms and initially 2 dental exam rooms. Then we figured we need more. So we decided to change the office into another dental exam room. So now we have 3 dental exam rooms. At the beginning, we were only going to bring a part-time pediatrician. Then, along the plans, we changed that to a full-time pediatrician. So full-time pediatrician, full-time family practice doctor, and a full-time dentist.
We're here with Dr. Sanga, who is one of the doctors who will be staffing the new Woodville clinic. And the wonderful thing about this clinic, 6 exam rooms. It's quite spacious. It also has 2 dental, 3 dental exam rooms. So it's both services, both ends of the medical spectrum. And could you talk a little bit about, we have the state-of-the-art, these are not normal charts. I noticed you have quite a bit of computer record keeping and other accessibility.
We're using the electronic dental records, so everything that we don't have paper charts anymore. We have no pens, we just type into the computer. Basically it goes to our server and it becomes an electronic dental record. At the same time, the x-rays are connected to the record right away, and you can see them right away. And we have a computer monitor, so when the patient, while being done a procedure, they can watch some shows for learning shows about it. So it's basically a state-of-the-art equipment that we have here.
And then it grew bigger because then we decided we're going to have a community room. So we did the education. We have a stove and we have a refrigerator to be able to do community presentations. And then we decided we're going to do Covered California here too. So we're going to enroll patients into Medi-Cal and the exchanges for the Affordable Care Act. So slowly. And then we decided we're going to send a fitness instructor into the school like we do at the Tulare Elementary Schools. So Miss Denise Carter is out here and she is at the schools doing Pilates, aerobics, different types of exercises at the schools. Then we said we're going to also send a teenage pregnancy prevention program to the schools, just like we do in Tulare at the high schools. So this is for the older kids, 7th through 8th grade. So we want to be able to prevent teenage pregnancy. So those are some of the things that we were doing. So the county made it happen quickly. And then Greg Nunley, the Driven Construction, our contractors, we told them we're on a timeline. We need to finish this completely, and this is going to be a priority. They started on February 9th, and they finished today, May 9th. Exactly 3 months. They lived here day and night. They made everything happen so quickly to build a building this size, 4,000 square feet, in such a short period of time. It's amazing. The dedication of everybody, the blessings, truly the support from everyone around here. The county, the schools, especially the school and the county, and HEART program, community-based, just different partners around. We are truly blessed. We also have a shuttle that we bought. This was also an afterthought. We said, what about those services that the people in Woodville cannot access? So we decided to buy another shuttle, which is a van, and we transport patients to and from their appointments. So if a patient does not have access to lab or x-ray and doesn't have transportation, we will take them to Tulare and back to Woodville. So that's one of the things that we also do.
Yeah, you push it.
Can we take some of them over here?
Yeah, inside the room.
Okay. So
What are you teaching right now?
I'm just teaching a little bit of why do the kids come to the doctor. I'm telling them that they not only come when they're sick, they gotta come when they're healthy too, to get immunization. And the shots that nobody likes it are to make sure that they keep healthy. So they're learning a little bit.
Yeah.
Okay, we're gonna look at your ears and we're gonna have all the kids look inside. Okay, here.
And also, if you want to get a hold of us or reach us, if you for an appointment, please call us at 559-686-9097. Again, 559-686-9097. You can also visit us on our website for addresses, locations, and hours and services. In Tulare, we provide much more, specialty OB and many, many other services. And that's at www.tchci.com. TCHCI, and it stands for Tulare Community Health Clinic, Inc.